Slide 1. Hello, and welcome to the Oregon Doula Association's Medicaid webinar series. My name is Letitia West, and I serve as the membership chair for the Oregon Doula Association. Slide 2. The Oregon Doula Association serves as a unifying, inclusive, statewide professional organization for all doulas. We provide support and resources for doulas. We publicly educate on and advocate for the benefits of doula care. The Oregon Doula Association was formed to improve maternal and infant holistic health outcomes, ensure healthcare equity, and cultivate culturally appropriate and humanistic maternity care for all Oregon families. We advocate for the increased integration of all doulas as standard of care in maternity care and promote and implement culturally specific models of care, community-based emotional support, trauma-informed care approaches, and advocacy as set forth by the traditional health worker doula guidelines.
Hi, my name is Jessie Reamer, and I'm the Education Chair for the Oregon Doula Association. I'm here today in our webinar series to share the history of the traditional health worker doula. Slide number 2. Traditional birth attendants have historically been community caregivers since humans have been giving birth. This age-old tradition has consisted of family, friends, and community caregivers who were knowledgeable or who had lived experience with childbirth themselves. The term doula, to be in service of the birthing person, self-developed from these grassroots origins to include a doula profession that had a set of professional standards, code of ethics, and more. As more and more births moved into hospitals and health systems in the 1900s, and the positive impact of doulas in the childbearing year became well documented, the presence of doulas were shown to reduce interventions, increase positive outcomes for maternal healing, advocating for breastfeeding rates, postpartum healing, and mental health, all while saving money in a costly healthcare system. Slide number 3. In the 2000s, doula care and health equity became intimately linked as the reality of the United States maternal health crisis became evident. The number of women who die giving birth in America each year has been nearly doubled in the last 2 decades. The United States has a higher rate of maternal death than 45 other countries, and is the only developed country with a consistently rising maternal mortality rate. This crisis disproportionately impacts Black, Indigenous, and people of color, as nearly 4 times more likely to die in childbirth than their white counterparts. This is due in many reasons, including provider shortages, lack of insurance, chronic conditions, over-medicalization, racial and social disparities, lack of comprehensive coordinated care, and disrespectful treatment. Slide number 4. In an effort to directly address the maternal mortality rate crisis, Oregon has made a historical move in recognizing doulas as traditional health workers as adopted in the Oregon Health Authority's OARs. A birth doula is a birth companion who provides personal, non-medical support to families throughout a person's pregnancy, childbirth, and postpartum experience. Slide number 5. The historic doula journey from an age-old tradition to being one of the most crucial healthcare equity movements in modern maternal care starts here in Oregon. Oregon and Minnesota were the first states to recognize doulas as Medicaid providers, building the foundation for integration into the federal funding and reimbursement pathways. The Oregon Doula Association formed in 2013 in response to this traditional health worker recognition that included both the benefits of reimbursement and increased access to doula care, but it also increased regulation of the doula workforce. The ODA has been the predominant voice of doulas advocating for sustainable doula workforce on topics that include scope of practice, sustainable reimbursement rates, access, and billing. Slide number 6. Integrating doulas into the healthcare system represented a unique challenge and historic journey, as doulas have historically been grassroots community caregivers since humans have been giving birth. This was not a recognized profession until the 1900s, when there was a separation of access to care by isolating birthing people in hospital settings. Birthing companions proceeded to create self-regulating organizations with a scope of practice, standards of practice, and specific emphasis on healthcare in the childbearing year, and renamed their role doula care in order to enter the healthcare system. This system was largely based on self-paying clients, however, which limited care to 6% of the population, primarily white women who could afford to self-pay. Some private insurances and federal reimbursement accounts or nonprofit organizations would fund or reimburse doula care. Slide number 7. Prior to the 2013 doula care had no federal or state regulation. Looking for solutions to the burgeoning healthcare crisis, Oregon and Minnesota became the first states to recognize doulas as traditional health workers, with the explicit goal of expanding access to doula care to Medicaid clients. In 2011 and 12, with House Bill 3311, it required the Oregon Health Authority to explore ways to use doulas to improve birth outcomes for women who faced disproportionately greater risk of poor birth outcomes and to report it to legislative committees. In February 2012, the subsequent report found that the doula's use could be useful in improving birth outcomes for underserved women and should be reimbursed by Medicaid. This bill would bring doula care to the most underserved populations: Black, Indigenous, people of color, young, and houseless individuals. Slide number 8. Between 2013 and 2019, there was a creation of a new system of reimbursement for the traditional healthcare workers that had not been previously existed, provided by an arduous and complicated task. House Bill 3407 established the Traditional Health Worker Commission within the Oregon Health Authority to adopt rules and criteria and descriptions for the coordinated care organizations to use with respect to healthcare workers who had previously not been licensed by the state, also creating training and education requirements for those workers. Doulas and other THWs actively worked to forge a payment mechanism so that doulas could actually be reimbursed by the healthcare HB 3407 that it mandated. Oregon Doula Association advocated for the sustainable infrastructure by writing a doula white paper outlining the basic scope of practice of doulas and completing a workforce development survey in 2018, a 90-page assessment regarding barriers to the growth of the doula profession and in joining the THW registry. In 2019, the ODA completed a payment model overview in response to the burgeoning question, how will doulas get paid? This payment model overviewed and addressed the sustainability challenges, that the rates were too low to meet doulas' basic needs, billing pathways were too complicated, and would be able to address this later in the session. Slide number 9. In 2020, coordinated care organizations, the nonprofit regional organizations that distribute Medicaid funds, were mandated to contract with THW providers and create THW liaison positions to help connect THWs with the coordinated care organizations. In 2022, with continued ODA advocacy, the Oregon Health Authority approved one of the highest rates for doula Medicaid reimbursement in the nation at $1,500. Slide number 10. The Traditional Health Worker Commission was formed and housed at the Oregon Health Authority Office of Equity and Inclusion. The Traditional Health Worker designation is administered by the Oregon Health Authority in the Office of Equity and Inclusion. The Traditional Health Worker Commission has an appointed representative for each worker type, as well as in each subcommittee. A THW doula sits on the commission to represent doulas, and open public comment is always welcome. There are also subcommittees for training and education, systems integration, scope of practice, and payment models. Slide number 11. The purpose of the Traditional Health Worker Program is to diversify the healthcare workforce, provide high quality and culturally competent care to our increasingly diverse populations, and ultimately promote health equity. Traditional health workers help individuals in their communities, providing physical and behavioral health services. There are 5 traditional health worker types: peer support specialists, personal health navigators, peer wellness specialists, community health workers, and doulas. Slide number 12. For doulas and people interested in becoming doulas, the realities of receiving a sustainable reimbursement rate and offering health equity-centered care within the communities makes the profession more attainable. The process to becoming a THW doula are outlined here. The pathway includes step 1, completing an OHA-approved THW doula training and the additional Oregon Health Authority required advanced trainings. Step 2, providing 3 births and postpartums, as well as building a personal resource list. Step 3, submit the THW Doula application. Step 4, complete the Oregon Health Authority background check. Step 5, become an approved THW doula on the state registry for 3 years. And the last step is to reapply every 3 years with personal contact hours in education. Slide number 13. The THW doula pathway. Training and certification is the first step to becoming a full-fledged THW doula. After getting on the state registry and becoming a Medicaid provider with the state of Oregon, a doula can seek different employment opportunities, including working solo, contracting directly with community care organizations, working with community doula billing hubs, or contracting with hospitals and healthcare systems, or all of the above. There's no exclusion. To maintain the THW doula status, the doula will need to reapply every 3 years. There's no fee for the application, but continuing education credits will need to be documented in this renewal process. Slide number 14. So how does a doula get reimbursed again? Become a THW doula by applying and qualifying for the THW state registry and completing the paperwork to become a Medicaid provider in the state of Oregon is the first step. Contract or bill with a number of billing options is the next step. First of all, as a solo doula, you can join a CCO and it will allow you to bill the CCO directly, or join a community doula hub billing contract with CCOs or the state of Oregon directly at the base rate, whichever is designated as the Oregon Health Authority base rate at the time. Contracted rates with CCOs may vary and are often more than the base rate in order to fulfill the provider access role. Contracts with a hospital or other health equity entity will also be able to do billing for you and also be able to provide Medicaid client leads and matchmaking services. You can also do all of the above. Slide number 15. The initial rate of the $75 for the birth and $25 each for 2 prenatal visits and 2 postpartum visits, totaling $175, was initially set without any input other than a Medicaid formula. This rate was proven to be unsustainable, however, by the lack of a workforce response to becoming THW doulas, as well as by the cost effectiveness study on doula care, which was advocating for a range of cost savings just in the initial cesarean birth reductions as a savings of over $1,200 per birth. Advocating for a rate increase as one of the initial barriers to establishing a doula workforce, the fee for service was raised to $350, $50 each for visits, and $150 for the birth. Community care organizations' contract rates, however, increased from $800 to $1,200 and were set in order to increase the doula provider workforce through these additional increased rates. However, continued ODA advocacy for sustainable doula rates argued that the impact and inflation over the 10-year implementation process required an additional look at this rate. This led to the proposed 2022 fee increase for a rate of service proposing $1,500, which is one of the highest in the nations, and that is being implemented in 2023. Slide number 16. So to recap, Medicaid billing pathways include billing hubs, which are often community doula groups providing specific billing for their members. Direct community care organization contracting, which means that doula can provide direct care and bill themselves through the CCO. Hospital billing, which are contracted doulas with individual hospitals, providing direct care to the Medicaid patients of that specific hospital and receiving billing and compensation. And also commercial insurance or employer reimbursement. And to this date, those things are still in development.
We'd like to thank the individuals who contributed to this webinar series project. Marta Rivera, ODA President, Doulas and Company, Doula Training Center. Iris Bixler, ODA Policy Chair, Senior Traditional Health Worker Liaison, Pacific Source Community Solutions. Alicia Bublitz, ODA Treasurer. Raven Nolan, ODA Vice President. Jesse Reamer, ODA Founding Member, Education Chair, Mother Tree International, Gateway Doula Group, PDX Doula Group. Brooke Haynes added Simply Real webinar editing. Second to last slide, we would love to have you join the Oregon Doula Association as a member. Membership benefits include accessibility to webinars such as this, information on doula events in your area, educational resources, discounts on training opportunities, and an opportunity to be in community with doulas statewide. We have doula affiliate, and organizational affiliate memberships, and also have scholarships available. Please visit us at ordoulas.org/join-us for a membership application. Also, if you have any questions, please contact membership@ordoulas.org. We would like to thank our sponsors for support on this Medicaid webinar series, Care Oregon, Trillium Community Health Plan, and the Eastern Oregon Coordinated Care Organization.